the U.S.?
DC, New York, and Maine.
How do you all know each other? We're all medical students. Where are you going today? We're going to Vancouver.
With over 45 million uninsured Americans, healthcare reform in the United States has been a hotly debated issue in the past few years. As future physicians, members of the American Medical Student Association have been passionately working to increase awareness, discussion, and action on improving healthcare access for all Americans. As every other industrialized nation has some form of universal health care, there exist a number of models on which to help shape discussions on policy reforms in our own country. Fascinated by the striking difference in the healthcare systems of America and bordering Canada, and curious about Americans and Canadians' perceptions of their healthcare systems, we set out on a week-long study tour to Seattle, Washington, in the United States, and Vancouver, British Columbia, in Canada. We organized this study tour 2 years in a row, with almost 30 medical student participants, and we called it Seacouver.
I just love our healthcare program that we have here. Yeah, I'd say you can eat a pineapple, an orange a day, and just hope to stay healthy. That's as good as it gets at this stand here.
On our study tour, we learned that people's perceptions of the American and Canadian healthcare systems were so different that it was like comparing apples and oranges.
I think it's rather poor because everyone doesn't have health care. And unless everyone has health care, your system isn't working.
Healthcare is not available as much as it should be. It's available for very wealthy people and to some degree for poverty-stricken people. I think people in the middle are underserved.
I think in the United States, basic healthcare should be a right.
A right? Healthcare being a right? That's kind of a...
I think it's something you have to work for. You know, you gotta pay your dues, you gotta put into the system before you get out. I don't like the freebies. Bozo the clown down there overdoses on Mad Dog. We get to pay his hospital bill, right?
Well, I just bought a life insurance policy once. I never bought health insurance because I never figured I could afford it.
If anybody should have good health care, it should be here. But it's prohibitively expensive, as it is all over the country.
Right.
And it's not because it's not there. It's only there if you can afford it, and that's the problem.
What do you think of the kind of care that you receive?
Excellent. Yeah, I've been all over the world, and I think it's the best here.
I mean, we have advanced medical equipment. Our pharmaceutical products are cutting edge. We have one of the best healthcare equipment and just the facilities, medical equipment, facilities, preventative care, naturopathic medicines that are available here in the United States. I think that's cutting edge. It's all cutting edge technology and chemicals and medicines. So I think that's one thing that's very, very strong in our country.
I think we probably have some of the greatest health care available to us. Maybe anywhere, I don't know, but it seems like we have really good health care available to us.
But many working families have no access to healthcare, and that's profoundly concerning. Also, the cost seems way out of line with other developed countries.
Here in the state of Washington, there are many people, families, who are workers. Both parents are workers, and they still can't afford health care. I think that's a travesty.
I have very good health care in the main because I'm a public school teacher. But I have friends who don't have any because they're self-employed, and they always kind of walk around at risk, and that's a little bit sad.
A lot of people are left without health insurance, and often it's too expensive for companies to get it for their employees, so that's kind of bad.
I work for an employer that gives us good medical rates, so that's the reason why I stay at my job. Even though it's not the best, I stay there because of the medical.
Well, what do you think about the American healthcare system? We'll start out there.
Guys are in trouble. Serious trouble. Profit for private for, at the expense of somebody's health. It's not good.
It's horrible. Yeah, it's horrible. And hopefully we don't go that direction, because there's a lot of people that miss out on health care.
I had need of hospitalization when I was in Florida holiday, and the doctor said to me, "Get back to Canada. You can't afford to be here."
Because I think the care is probably great there. I mean, I've never been in an American hospital, but no, it's the expense.
Right.
They can't afford it. It's ridiculous. I mean, that's what you hear here as from Canadians. You hear, my God, don't ever get sick in the States, because if you get stuck in a hospital, you have to pay this much for your bedpan and this much for your toiletries. And so, no, they would not want to go to the States. In fact, they try not to. The only time they ever really go is if they need, to go to the Mayo Clinic or something like that.
Because there's no options for Canadian healthcare users. If you're put on a wait list and you have a serious medical condition, you have to really go to the United States for the most part right now in order to pay for it yourself. Because Alberta has some private healthcare options, but most provinces don't. And so you can really kind of be out of luck. You're really reliant on the system to get you through and to make you healthy, and there's not a lot of other options. And I think that's what really bothers a lot of people.
I don't personally like their medical system at all, where it's if you have money then you get medical attention. I don't agree that. I think everybody should get medical attention. I don't know if it's just because you see it in TV and media and radio and all that kind of thing. Like, one of the first questions is, what kind of coverage do you have? Kind of thing before you walk into a hospital room. What's your medical coverage and all that. I think that shouldn't be the first question you ask. It should be, what's your name and what's wrong and all that kind of stuff, instead of what's in your pocketbook.
Well, American health care, as I understand it, hospital cannot turn anyone away. It's against the law. So if you have a real problem, they can't turn you away. I also know I have friends in the medical business in the United States, and a lot of them do pro bono stuff for patients. So, yes and no. So is that better or worse? I don't know.
I've heard a lot of different things. I know that a lot of drugs that maybe you can't get here in Canada, you can get in the States, which might be better because you have access to a broader range of medications. I don't know if this is true or not, but also I hear if you get really sick and you don't have proper insurance, it can be very costly.
And the perception is that everybody's on his own in the U.S. And that there is obviously a bias with this approach because people in the lower tier, economically and socially, are penalized.
There was a time in the U.S. where I could see what it would like to be like when you're employed. You can afford health care. When you're not employed, it's very inconceivable where you can't afford health care. And that's the time when you need it most. I think you're doing a lot of transitions in life. You're moving. That's taxing on the immune system. The vulnerabilities for flus or colds or even injuring yourself because you're distracted in transitionary sense of life.
The thing is, that there's a double-sidedness here. What you read about American medical research is awesome, and you read about kids being flown down to the Mayo Clinic or whatever for, certain procedures that aren't available here, because the research is right up there. How many people can access it? It's the access that's lacking for everybody.
So would you ever